Hello, everyone. Welcome to Healthy Bytes. I'm Sheldon Baker, editor for Innovision Health Media. My guest today is Dr. James Greenblatt, a pioneer in the field of functional and integrative medicine and board-certified child and adult psychiatrist who has treated patients since 1988. After receiving his medical degree and completing his psychiatry residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. He is the author of 7 books, including Answers to Anorexia, Finally Focused, the Breakthrough Natural Treatment Plan for ADHD, Functional Medicine and Integrative Medicine for Antidepressant Withdrawal. Dr. Greenblatt was inducted into the Orthomolecular Hall of Fame in 2017 by the International Society of Orthomolecular Medicine. He is also the founder of Psychiatry Redefined, an educational platform dedicated to transformation of psychiatry, which offers online courses, educational webinars, and fellowships for health professionals. Dr. Greenblatt, thank you for coming on Healthy Bytes today.
My pleasure. It's good to be with you.
So let's get into it. What is functional psychiatry and what is the role of nutrition in mental wellness?
Well, I think nutrition and nutritional deficiencies is a tremendously important, very neglected part of mental health and mental illness. Our brain is the most metabolically active organ, and nutrients are critical for optimal functioning.
How about the role of nutritional lithium in childhood behavior disorders and ADHD when it focuses on irritability?
Sure, a big part of my career has been helping people understand that lithium is not just a medication that we use for bipolar illness, that it's actually a natural element, right? We use it in computers and batteries, but it's also a nutritional supplement and has profound implications for brain health. So I've been using it for over 30 years to treat symptoms like irritability and impulsivity and anger issues. And it cuts across many psychiatric disorders, ADHD being common in childhood.
Can you explain a little about the plus-minus healing plan from your book, Finally Focused?
Sure. We wrote a book a couple of years ago on for ADHD, a nutritional plan to help parents and professionals understand how to integrate nutrition into a treatment plan. And we just kind of set the program up as something simple to remember and understand and call it the plus-minus plan. Plus meaning what micronutrients would we need to add? And that's particularly things like magnesium and maybe the nutritional lithium. And then what things do we need to minus? And that could be the ultra-processed food, the additives, or even things like heavy metals like copper. So it's an organized plan to help parents appreciate how to very simply integrate nutrition in an ADHD treatment plan.
We hear ADHD is related to disordered eating. Can you talk about that?
Sure. I've also spent many years treating anorexia nervosa and binge eating disorder. And there's a very high correlation between kind of ADHD, particularly in women, and disordered eating. And too often it relates to kind of binge eating disorder and other forms of disordered eating. So by treating ADHD and understanding how to treat it, oftentimes we can help prevent some significant disordered eating problems in young adults.
What would you say are the current limitations of our mental health treatment model today?
Well, my career has been based on trying to shift the current model, which is really just symptomatic-based medicine. In psychiatry, all we have is a checklist. We ask patients lots of questions, and we say, you're sad, you get an antidepressant medication. You're anxious, you get an anti-anxiety medicine. The biggest concern in our mental health care system is not looking at underlying cause, not looking at nutritional deficiencies, not looking at hormonal deficiencies. So the concern is our current model is symptomatic-based medication management, and we need to shift that to a functional medicine model, which is looking at nutritional deficiencies and root cause.
In your estimation, do mental health issues affect women as equally as it might men?
Yeah, there are some disorders that are higher in men and some higher in women, but I think our children, our adults, and males and females, are suffering. And the current model of just throwing pills, and then we call it polypharmacy, multiple pills, helps some, but many are still struggling.
We hear a lot about the vaccination controversies or theories, if you will. In your mind, is that a hindrance in any way?
I'm sorry, you said vaccination?
Yes.
Yeah, we haven't seen that as an issue in terms of mental health problems. I think the mental health problems are patients worrying, either over worrying about a disease or over worrying about the effects of vaccines.
I have to ask this question, and I hope you'll feel comfortable answering it. Any thoughts that you might have about the MAHA movement as far as your work is concerned?
Well, I think, my work is pretty much apolitical, helping patients get better. And I think there's certain very powerful issues coming up, like removing ultra-processed foods and eliminating the food dyes and food additives to some of our foods are incredibly important. So there absolutely would be some important components that embrace integrative and functional medicine, which is the foundation of the work that we do.
As you indicated, that you've been doing this work for a long period of time. How have things changed? Certainly, we hope for the better.
I'm optimistic. I think that as a community of mental health practitioners, younger doctors are looking for alternatives. People now have research supporting the role of nutrition, the role of the gut, and understanding hormones. So I'm optimistic that we can take the progress we've made with some medications and add the new exciting research on genetics and epigenetics and nutrition to improve mental health outcomes.
Your thoughts or feelings about supplements versus medications?
In my career and the training that we do for doctors, that we integrate both. There's a role for medications, and there's a very huge benefit to understanding where nutritional supplements can fit in a treatment plan for someone struggling with depression, anxiety, or ADHD.
Very good. People want to get a hold of you, want to utilize your expertise. How do they do that?
Sure. I have a website, jamesgreenblattmd.com, and I have a new book coming out in January on functional medicine for depression, a program to help patients understand functional medicine. And our training program for clinicians is psychiatryredefined.org.
And I imagine your current books are available either on your website or through Amazon?
Yeah, absolutely. We have books on ADHD, eating disorders, and antidepressant withdrawal protocols.
My guest today has been Dr. James Greenblatt. He's a pioneer in the field of functional and integrative medicine. Dr. Greenblatt, thank you for joining me.
My pleasure. It's good to be with you.
And thanks to all of you for watching Healthy Bites.